If anyone joins later, I'll be able to admit them. But let's start now, just so we're on time. Welcome, everybody. Today, we have our bowel cancer screening webinar, um, and we are um, kindly Dusan from the Health Promotion Lead for Bowel Cancer Screening, King's College London, is going to be taking today's session and going through things that you'll need to know for the screening process. A little bit of housekeeping before we begin. If you have any questions, just put your hand up or write a chat message in the side box. There should be the option to type in a chat, and Lauren and I will be able to pick it up and we'll be able to ask the questions at the end or keep them for when you think it's appropriate to ask them or whenever. And yeah, we'll keep track of it. It's also being recorded today, so I'll send out the recording afterwards so you'll be able to listen back if you forget anything or it goes too quickly. Okay, all right, let's begin. Over to Dusan to do the talk.
Brilliant. Good morning, everyone. My name is Dusan. I'm the health promotion lead for the bowel cancer screening here at King's College Hospital, mainly in London. And we look after two sort of boroughs, but the bowel cancer screening, as I explained already for Hayley and Lauren, it's across all of the UK. So Hayley and Lauren, thank you very much for inviting me and really nice to see you guys. Because I have my presentation going, I can't really see much. So if anybody has any questions or anything, Hayley and Lauren, please do just let me know. This is just going to be sort of an overarching picture about what the bowel cancer screening is, what the bowel cancer is, what are the risk factors, but also we're going to talk about the process of how the actual bowel cancer screening is being done within the UK itself. So when we talk about the bowel cancer is literally the cancer of the big bowel. So we're literally talking, I'm hoping you can see my pointer here. So we're literally talking about the larger bowel, which include also anus. So we also call it, that's why sometimes it's called bowel cancer, colon cancer, or anal cancer. But it literally only involves this area of the big bowel itself. Bowel cancer itself, as it says on the actual slide, is the fourth most common cancer within the UK. And this number actually, it's a lot higher now because the recent numbers actually are given to us is that we get around 48,500 new cases of each year. And why is it important? It's important that even if it's not such a prevalent cancer within the UK, bowel cancer is still the second leading cause of cancer deaths. And this number is actually now around 20,000 deaths annually. So it is quite sort of negligence from the point of view that it's not as frequent as other cancers. We're talking about like cancers like breast cancer, pancreatic cancer, and similar. But the main concern is because the actual that cause it's still literally the sort of one of the high ones within the UK itself, and especially England, England itself. Yeah. When we talk about the risk factors, we can divide them in the ones which we can change, which is the modifiable one, and the one which we cannot change or non-modifiable one. I'm going to sort of discuss, of course, the one which we cannot change. So the older we become, our age, etc., that's influence we're becoming at a higher risk of developing the bowel cancer itself. And this is something to do which we cannot change itself in general. Some people are just sort of, as we grow older, we are higher the chances of developing any kind of sort of long-term disease or anything like cancer also. Family history. This is really important because we're talking about primary family members. So if you have any primary family members like mother, father, brother, or sister who have had a bowel cancer, you're at a higher chance of developing sort of bowel cancer in the sort of the future. If you have more than more than one family member at the sort of who has previously bowel cancer, especially under the ages of 50, we always do advise people to actually to go and speak to their GPs because they will be able to sort of to refer them to the specific sort of genetic services where they can actually give you a sort of a percentage of water possibility and what can be done to actually to prevent the bowel cancer itself. I just need to say that within London, those services do exist. I can't speak about the longer sort of the other areas within the UK, but the best port of call would be your GP to actually to ask and see what services are available. But the genetic services will just be able to literally provide you an idea what the possibilities are, and you would be sort of followed by the team to actually to see that the cancer doesn't happen in that way. Then I know it's literally written here inflammatory bowel disease, but this is to do with medical conditions. So one of the medical condition which is mentioned here, it's inflammatory bowel disease or IBS, which is many people have sort of heard. Also another sort of medical condition which can cause bowel cancer. It's also polyps. Polyps are little growths which are sort of found within the actual bowel, which if they're left for a long time, they can actually become a bowel cancer itself. Also, people with diabetes too, there are 30% high chances of developing bowel cancer, and also people who have a Lynch syndrome. If you have not heard of Lynch syndrome, you definitely don't have it. But to explain Lynch syndrome, it's a genetical condition which sort of predispose you, giving you a higher chance of actually developing cancer within the sort of further down the line. And these patients are actually followed by the system in general and by the NHS. But we'll talk about the Lynch syndrome in a little bit later because that's to actually distinguish the pathways of how the bowel cancer screening is done. So these are the sort of the risk factors which we cannot change, but also one of the sort of things which we need to talk is the ones which we can change. And this is also when we talk about the medical conditions like diabetes 2. Diabetes 2, it's mainly a condition which is sort of to do with what we actually eat. And this is another thing which we can change, but only if we sort of change sort of like things like diet or similar. Now, when we talk about diet, as you can guys see that in the photo, we're talking mainly about the processed food, fast food. So we need to try and avoid that because in the actual when we do about the numbers, how much cancer is being caused by a variety of things within the diet, it's about good 30 to 40% of cases of the cancers, not only about bowel cancer, they're literally caused by the processed food. So we need to try and limit that as much as we can. Of course, if we're not using enough fiber, about 13% of bowel cancer is caused by not eating enough fiber. And of course, we also, a lot of people forget to actually drink water. Water is actually quite a good thing. So the more water we drink, the better. And of course, depending how old we are, some people can actually drink a liter of water a day. We usually say 2 to 3 liters, but I'm sort of understanding that not everybody is able to drink that much. But we are also not talking about drinking water in one go, 2 liters. We're literally talking about throughout the day. So that literally comes up to 8 cups of water throughout the day itself. So this is more like a preventative thing. Of course, when we talk about the lifestyle, we need to mention smoking and alcohol. And I know that a lot of people will say literally what that has to do with bowel cancer. When we're actually smoking and drinking, we're actually, by smoking, we're inhaling a variety of particles which can sort of influence the bowel. And also the same thing with alcohol. But when we talk about alcohol, we're not talking about one drink once in a while. We're talking about chronic drinking. So literally drinking almost every day. Both of these, of course, we cannot say to people, don't do it. We would rather people not do it, but we would always say everything in moderation, and that also includes the food itself. But if you can stop either of those, that will be sort of beneficial not only to prevent bowel cancer, but also other cancers which are sort of caused by alcohol and smoking itself. Inactivity and obesity, of course, it's another thing which can influence bowel cancer further down the line, and that also includes physical activity. So the more active we are, it's sort of influencing how we're actually looking, and it's also actually helping with your bowel itself. Because again, if we're eating enough fiber, if we're drinking enough water, the most important thing about the bowel is literally to have a constant bowel movement, or to actually that we have bowel movements that they are not constipation, there's no constipation or diarrhea or anything similar. So this is really important because all of these risk factors, like I said, the one which we cannot change, they're influenced by as we sort of go along throughout our life. But the ones which we can change is definitely the ones which we said about diet, smoking, alcohol, and inactivity and obesity itself. Um, so, what are the common symptoms of bowel cancer? So, usually, what we do say that the most common one it's the blood in your stool or blood in your poo. So, we are talking about either red or dark red sort of color in your poo, or sometimes also even black. The color of the pool mainly means that depending what side, where in the bowel it's actually the bleeding is happening, but any type of blood in the stool, there is not a certain amount of blood which is normal in the stool to actually to say this is not bowel cancer. We will always say because when I actually go in the community, people, the public, you usually ask me, is there a certain amount of blood which is allowed? I will always say to everyone, there is no amount of blood which should be in the actual pool, and that's why it's one of the sort of the biggest symptoms which we need to look for. And I know that sometimes people they say, well, nobody actually looks inside when we actually go to the toilet. Nobody looks actually to see if we have blood or anything. So time to time, I would always advise to do it, or even when we wipe after the actual process itself. Another symptom is, of course, also changes in bowel habits. So we're talking anything about the number of times you actually go to the toilet, but also we're talking about if you are experiencing constipation or diarrhea. We're not talking this happening once every once in a while. We're talking more about these symptoms lasting more than 3 weeks, and that's in relation to the constipation and diarrhea. Weight loss and fatigue, of course, it's one of the sort of symptoms of majority of the cancer itself. So it's not only for bowel cancer, but I always do try to explain to people if you're actually doing hard work and you know that you're doing quite a lot and you're feeling tired, we have the reason why we're feeling tired. But if the tiredness and fatigue comes out of nowhere, this is something which we need to sort of to look for and not to look for, but to actually to question with the GP what the possibility could be. Again, any type of abdominal pain or lump also is a sort of a possible sign of symptom of bowel cancer. But also, as much as we're guys talking about variety of these symptoms, it doesn't necessarily mean let's say that if we see the blood in your stool, that doesn't necessarily mean that it is the bowel cancer. It can be anything like hemorrhoids, it can be piles, it can be IBS. Because myself, I do suffer from IBS myself, and I know if I eat certain food, my bowel reacts in that way. So I would know what the reasons behind the actual poo is. But this is something which we need to sort of to keep an eye on, especially because if it's happening, like I said, for a long time, we need to sort of to go to the GP and check the reasons why is this happening. Um, so when we talk about the bowel screening, it's a really simple, it's a national program, and it's a really simple test, and it possibly one of the very few tests which we can actually do at home without anybody poking us or prodding us. We're doing it in the safety of our home, so it's much easier to actually to do it. And why is it important to do it? Because actually, with the test itself, we can actually detect the bowel cancer at the early stages, which of course will then save more lives. And that literally means because bowel cancer might be the sort of, as I said, the second highest killer within the UK, but the earlier we detect the cancer, the earlier we can actually treat it, and it's one of the most treatable cancers of all when we compare with the other sort of cancers within the UK itself. How it works? So we are literally sending a small stool sample, which we're going to show a little video how to actually to do this. But it's literally looking at the smallest particles of blood in your stool or poo, and that means sometimes, like I said, even those particles are not visible by the actual naked eye. The actual testing kit will be able to actually to find it and see it, because we actually want sometimes to actually to catch people even before they're developing symptoms, because sometimes people can have bowel cancer but not actually having major symptoms, like I said, like I mentioned, anything like pains or anything like that. So the bowel cancer screening is a part to actually to try to preempt the actual position of finding the people at the earliest stages of sort of the bowel cancer itself. Now, I'm sure that you have guys sort of seen these type of testing kits before. The one on the left, it's for the within England and Wales and Northern Ireland, and the one on the right is the testing kit how it looks in Scotland. Um, I know that they look very, very different, but if I am to pull this portion out of the testing kit, it looks exactly the same like here, and it has sort of a ribbed bits which you actually need to collect the sample itself. But I'll show you all of that within the next sort of within the next slide once when I actually play you the video. But the reason why I'm showing this because I don't want people to think that they're completely different things. They might look different, but they're actually doing exactly the same thing, they're exactly the same process and everything else. The testing kit, it's called the fecal immunochemical test. The main reason why it's called that because fecal it's stool itself, but immunochemical test is because we're literally looking for the particles of blood within the stool sample itself. The shortest way to remember the actually, if anybody asks you, even if the doctor asks you, the testing kit is actually called FIT, which is literally stands fecal immunochemical test. So for you not to, you don't need to remember the name of it as long as you actually know the name is a FIT testing kit. So if anybody asks that FIT testing kit, it's for the bowel cancer screening itself. Um, Now, this is quite important to mention because, like I said, again, different parts of the UK have different sort of reasons and the age groups where we're actually doing the screening. Previous range within the England, Wales, and Scotland was 60 to 74 years, and just till recently, we all sort of passed from October 2024. That age has been sort of changed to 50 to 74. But in Northern Ireland, it's still 60 to 74 to this day. And eventually, I'm sure that Northern Ireland will join the rest of the UK within the age ranges of 50 to 74. The main reason why this range was before, of course, because as older we get, as I explained within the risk factors, we have a higher risk of developing bowel cancer. But what's the reason why the age range is sort of starting to be lowered is because we are actually finding that younger people were also at risk developing bowel cancer, and even more within England. It's England at the moment is sort of one of the highest parts of the UK where people of younger ages, so we're talking even below 50, that they're developing bowel cancer itself. Um, but we're sort of trying now to find out, of course, the reasons why that's happening. Of course, as you can see, guys, the age extension timeline, this is again, I need to talk about England because I'm within England itself, but the same age sort of extension was literally going bit by bit. And as you can see, everything started just after COVID. It was supposed to start on well, literally the year when COVID started. And of course, that needed to be delayed due to the process. It is and everything what is actually happening what was happening within the country during that time. Um, right. So why I just literally mentioned this, so we're literally expanding the screening because the sort of the younger people are also at risk, especially within the people under the ages of 60. But also the screening sort of save earlier if we actually screening saves life earlier if we find it at the stage 1 and stage 2. We're not saying that people who are at stage 3 and 4 we can't cure, but at least we can sort of delay the onset. But usually the sort of the survival rate it's better or it's more than 5 years and over at the stage 1 and stage 2 because we can definitely sort of do something about sort of the treatment itself. And the treatments are, of course, a variety of things. I also just going to briefly mention here that the worldwide practice for the bowel cancer screening, it's different across the world. So if you're anywhere else, like America, you're possibly going to be screened from the ages of 40 and above. In Australia, it's 45 and above. In Japan, it's 42 and above. And this all purely depends, of course, of the resource and the research within the countries which they're actually doing, what is sort of being done within different parts of part of the world, and some parts of the world don't even have the actual systematic national screening. And I can also say from the country where I'm from, which is the ex-Yugoslavian part, we do not have national bowel cancer screening program, which is actually quite sort of interesting to mention. But like I said, everything it's more about because the National Bowel Cancer Screening Program, it's all to do with asymptomatics. So that means that we're looking after people who do not have any symptoms, if that makes sense. But it will make sense again when we actually talk about more about the pathways of how we actually do the national screening. Haley and Lauren, before I pass to the video, are there any questions which I can answer?
No questions yet. Does anyone have any questions that they'd like to ask before we just watch the quick video? No, nothing yet.
Okay, no
No.
worries, no worry at all. So what I will do, I'm just going to stop sharing this and I'm going to play a little video which literally explains the process of how to do the actual testing kit itself. So just give me a second. Hopefully it's not going to be playing any adverts. Just a second. So share and technology, when it works, it works. Right, let me just expand this. You can see this, guys. Yep. Yeah, brilliant. So I'm just going to play the video and it's not going to give me now because it's a big screen.
NHS bowel cancer screening fit kit. Finding bowel cancer early could save your life. That's why the NHS sends bowel cancer screening kits, known as fit kits, every 2 years to everyone in England aged 60 to 74 years old. The NHS is also rolling out the test, over time, to people aged 50 to 59. FIT stands for Fecal Immunochemical Test, and it is a simple test you do at home. It checks for tiny amounts of blood in your poo, one of the signs of bowel cancer. It can spot blood before you even notice anything is wrong. If there is blood in your poo, it doesn't always mean you have cancer. It's more likely to be something else, but if further tests detect that it is cancer, finding it early makes it easier to treat. To do the test, you only need to collect a tiny amount of your poo. When you receive your kit in the post, follow these simple steps. Open the box and read the instructions on the lid to familiarise yourself with what you need to do. Then leave your kit by the toilet so it's ready to go when you are. When you need to poo, write the date on the label of your sample bottle. If for whatever reason you don't manage to do the test on the date you had written on the sample bottle, remember to change the date when you do the test again. Now choose a suitable poo catching method, such as a plastic container, and line it with toilet paper before you go. Place the plastic container into the toilet, sit on the toilet and poo. It's important that you don't let the poo touch the toilet water or any pee. Twist open the sample bottle to release the sampling stick. Swipe the stick along the poo, filling all the grooves. Now put the stick back into the sample bottle and click the lid closed. You can now flush away your poo. Wash your hands thoroughly with soap. Put your sample bottle in the prepaid envelope, peel off the tape and close it. You do not need a stamp. Put the envelope in a postbox as soon as possible. You should get a letter within 14 days with your results. If you don't get a response in that time, call the free NHS Bowel Cancer Screening Helpline for advice on 0800 707 60 60. So remember, when you receive your screening kit, put it by the loo. Don't put it off. It could save your life. For more information about bowel cancer screening, click the link.
Brilliant. I love these videos because they're just so simple and easy to follow. And again, this is an older video, they have not created a new one. Oh, sorry, I do apologize. Uh, just a second. I do apologize because there was a video in the background. So as I was saying, these videos are really, really nice, and it's easy sort of to follow the instructions and everything else. And I know it did say 60 to 74, and this is an older video, but the process is definitely 50 to 74. I just need to mention this because I don't want people to think that if you're over the age of 74 that you should not be having a test. That's not true. You still continue. You can still continue with the actual national program. The only difference is that you would need to actually to order the testing kit. It's for free. And the main reason we're actually saying this because once when we sort of reach the ages over 75 and over, the risk of having the follow-up procedure, which is called a colonoscopy, which is a camera inside of your sort of bowel, um, the risks are a little bit higher to actually to get bleeding and things like that. So then sometimes the risk outweighs the benefit. So that's why it's more of a self-referral way to actually for anybody over the age of 74. So that doesn't mean that the national program stops at 74. It's just a more of a self-referral at the end of that, sort of at the after that age. That just means that you can either call the number for the actual National Bowel Cancer Screening Program, or you can even request it via the GP, but as an asymptomatic, so when you don't have symptoms in any possible way. The one thing which I'm just going to go back, I just want to show something because one of the main reasons I know that this box it's not closed at the moment, but one of the main issues which we do have when people are receiving the testing kit is that the box looks pretty much like a COVID test. As it was, if you guys remember, so majority of people would actually throw away this box even without looking at it. And I can completely understand that people still have PTSD from COVID. We all do, I think, time to time. Um, but sadly, we did try to change the box, but at the moment, I think that's not going to happen. At least not within England, England, Wales, or England or Wales. Um, but yeah, so please, if you do receive the box, do not throw it away. Of course, I cannot say to you guys, you need to do the test. I'm more here to actually to provide you with the information as much as possible. And then you need to make a decision to do the testing kit. But there are possible reasons why you should be doing the testing kit. And that's why we're doing sort of this education to provide as much information as possible. But I just wanted to show you the box again. And as you saw in the video, it's exactly the same as it was sort of for the previous testing itself. So I'm just going to go back to the presentation. Um, this sort of was explained within the video itself, but I'm going to sort of go through it again. So any individual between the ages of 50 to 74 within England, Wales will receive, and Scotland will receive the actual letter 2 weeks after they turn 50. So when you turn 50, you will receive your letter to actually to say that within the next few weeks, you will receive a testing kit for the bowel cancer screening as a part of the national program. The testing kits will be sent to you, and you will literally receive it 2 weeks ago. And I can actually confirm that because one of my friends recently turned 50, and it was literally like a clock on the dot. They received the letter when they turned 50, and 2 weeks later, they receive a testing kit. Of course, as the video also explained, you will collect a small sample of the actuals of the stool and return it via the prepaid envelope. The most important thing is, of course, to write the date of the actual sample when you're taking it. The main reason why we're saying this, because usually the sample does come, the actual little bottle comes with a liquid inside, which keeps the actual stool sample viable. So it takes about 3 days to actually to get to the actual lab itself. But just to make sure, we usually say that, of course, the sooner you send it, the better. And of course, the sample will be more stable. Is in a way of if we take it literally, if you put the sample in today and then you say, "Oh, I'm going to send it tomorrow," please do send it the same day when you actually collect it. The results themselves, they will be ready within 2 weeks after the sample is arrived in the lab. And those results will be received not only by yourself, but they will be received by us as a bowel cancer screening center. And also it will be received by the bowel cancer hub. Bowel cancer hub is the place which actually send the testing kits out. If no blood is detected, your letter will be saying that the test has come back negative, or it means that it's not abnormal. But if the traces of blood are found, that the letter will say that your test has come back abnormal. That doesn't mean cancer. It just literally means, and I know that the wording doesn't sound the best, but it will just literally say that the traces of blood were found in your stool. That doesn't mean it's cancer, but that will just mean that one of our team will give you a ring to actually discuss further testing. Um, and that further test, which is going to sort of to be, it's the colonoscopy, which I explained. It's a camera within the back passage, which is literally going to check where the bleeding is coming from and the reasons behind it. Um, as myself also had experience with this too, I can say from my experience, the colonoscopy, it's not pleasant, but it's not painful. And patients can actually have sedation. It's awake sedation, which literally means that you're there, but you don't remember the actual process of how it happened. And you would usually need a family member or a friend to be with you because, of course, sedation, will need to look after you after that. But if you're doing without the sedation, which I also have done, if you did not have a friend or family friend to come with you, like I said, it's not pleasant, but it's not painful in any possible way. So I can say from my experience, but like I said, different people have different thresholds in relation to that. Um, if during the colonoscopy, the actual consultant doctor finds anything which is of a worry, like if they find any polyps, which I sort of mentioned earlier, if people do find polyps within your sort of the bowel, those polyps will be removed straight away. It's not a surgical procedure; it's literally a sort of a removal. Um, and of course, in relation to that, how many polyps they're found, you might be sort of followed up even further within the sort of the medical team. And that will just literally mean that you will need to have a repeated colonoscopy in a year or 2 years, depending on how many polyps are found. Of course, then they can also diagnose if you have IBS, which was my luck on the day when I actually had. So it wasn't definitely cancer, but also at the end of the colonoscopy, at least this is the process within England. If they have found anything which is of a concern, you will be informed as soon as literally the procedure is completed. So that will literally mean that you will be informed we have found something which is of a worry, and you will be referred to the colorectal team, which looks after patients who actually do have bowel cancer itself. Now, when I mentioned earlier about the patient pathway, about the BCS pathway, I just need to show this, and you guys don't need to know this by heart in any possible way. But the main reason why I'm sort of showing this, just so you will have friends who are younger than you have friends who are older than you have possibly friends who are within certain conditions. So the national program, it's literally the number 2, which is the age extension pathway and also the self-referral pathway. So these two, so anybody between the ages of 50 to 74 and 75 and above, these are the part of the national screening pathway. That just means that if you are of the age of 50 to 74, you will receive your testing kit every 2 years at your home address. If you're 75 and above, you just need to call your screening sort of hub to order the testing kit itself. And as I explained, it's self-referral due to the sort of risk outweighing the benefit in relation to the colonoscopy itself. So it is a personal choice. When we talk about people below the ages of 50, this is the pathway which I sort of mentioned, which is more for people who actually are experiencing symptoms. So we're talking anything like blood in your stool, pain in your stomach, constipation, diarrhea lasting longer than 3 weeks. So these patients would go directly to their general practitioner, and the general practitioner will refer them to have a fit testing kit, which is for symptomatic patients. That's the main sort of the difference. So if you are below the ages of 50 and you have symptoms, you go to the GP. If you're within the ages 50 to 74 or 75 and above and you don't have any symptoms, you will receive a testing kit or you can order the testing kit. But there is a caveat there too. So if any of the patients between the ages of 50 to 74 or 75 plus, if you do have symptoms, please do not wait for your testing kit to arrive. Let's say I have a testing kit today. Let's say I'm 52. I just received my testing kit today to do the bowel cancer screening. I have completed the testing kit. The testing kit came back normal. Everything is fine. That means I'll receive a next testing kit again in 2 years' time. If, let's say, 6 months from now, or 7 months from now, or a year from now, I develop symptoms like the symptoms which I mentioned about blood, constipation, diarrhea, I do not wait for the testing kit again to arrive to me 2 years on. I would go directly to your GP to actually to say I have developed these symptoms, and they're going to put you on the symptomatic pathway itself. I know this possibly sounds complicated, but it just means, regardless whatever age you are, if you have symptoms, please go to your GP. But like I said, they need to be like, if it's blood, definitely GP. If it's constipation and diarrhea lasting longer than 3 weeks, definitely GP. If any lump or bump it's actually in the stomach area, please go and see a GP. So anything like that, please go to your GP itself. The only difference is that we have the younger ages and the ages which are for the national program. Lauren and Haley, am I complicating too much?
I don't think so. No, it's fine. I think it's better to just let everybody know everything you're saying now. And then if there's any complications, then they can
Sure.
ask questions at the end.
Because I know that a lot of, like I said, the only reason I usually do not show this sort of slide to general public, because I think sometimes it can be confusing. But I just wanted to show that not everything is it's sort of necessarily urgent, because like I said, if you're asymptomatic, which means no symptoms, you will receive your testing kit if you're 50 to 74. But if you want a testing kit, you can actually order it if you're 75 and plus, because we do have a system where we actually can see every patient who has ever had a testing kit, and the hub will be actually sending the testing kits when the next is due. So people don't need to follow. But also, if they don't remember when was the last time they had a test sort of itself, they can literally call the hub and ask the question, and they will tell them when the next test kit it's due.
Just a
Uh,
question on that,
yes.
which might be for the members.
Hmm.
So if someone is 75 plus,
Yeah.
would they go to their GP and request a testing kit?
So they will go to the GP to request a testing kit only if they have symptoms. So if they're experiencing any blood or anything like that. If they don't have symptoms, they can order the testing kit via the actual numbers, which I'm going to provide at the end of the session for each area. So it's literally the main difference, it's symptomatic and non-symptomatic. So the national screening program, it's non-symptomatic. So that means no symptoms, no issues, no anything like that. Okay.
Okay. Yeah.
But if we do have symptoms, then regardless what age we are, regardless which age group we are, we go to the GP. Okay.
Okay.
And then the last thing, it's literally again, which we mentioned earlier today, it's something to do with the sort of the medical condition. And one of the medical condition, it's called the Lynch patients. So that just means these are the patients who do have a genetical condition which makes them much more predisposed to actually to develop bowel cancer. And we are literally there actually followed up with the team anyway, generally, because the national team will already know whichever patient actually have a Lynch syndrome. And like I said, if you have never heard of it, that means that you don't have it, because it is a genetic thing and it's literally passed from parents to children and so on and so on. And I do apologize if I decomplicated that, but like I said, I'm more than happy to answer any questions at the end. But it's important, asymptomatic, so no symptoms is the national program. Symptomatic with symptoms, we need to go to the GP. Right. So the benefits we sort of mentioned already here, so I'm not going to stay too long here, but the main thing is the earlier we catch it, the better we can actually treat it. But also by doing the testing, we can actually relieve a lot of anxiety from people. If they actually have a testing kit, we can give the results. And I always say to people, because again, a lot of people within the community, when I speak to them, they actually say to me, well, I don't want to do it because I don't want to know, I'm scared to have cancer. I would rather people be a little bit concerned about having it, because if we actually find it, we can actually treat it. The sooner the better. And that's why we always do say sometimes the actual, even if you don't have symptoms and you do sort of are within the national sort of screening age, I would say to do the test, because we can actually find things wrong before they actually sort of go into a different stage when we can't treat it itself. Um, so the actual link here which says encourage healthy habits. This is definitely one which we always say to people when we actually sort of talk to the general public, that anything to actually to encourage any healthy habits, like I said, stop smoking, stop drinking, eating healthy, trying to exercise. But also to me, this is my sort of role to actually to provide as much information as possible to people to make their personal decision. I would like to do a test, not only for bowel cancer, but for any type of sort of screening, any type of follow-ups or anything like that. And of course, the last bit is to support health goals, public health goals. Of course, guys, as you know, the the sooner we can actually catch the cancer, the sort of the less sort of resources it's going or anything like that. And that's why sort of the national screening program, it's more like a preemptive strike before we sort of go into the sort of the later stages of cancer, so we can literally find it and treat it the earliest possible. Now, as I sort of mentioned, one of the sort of the reasons which we said about like a testing kit itself and the reasons, I'm just going to sort of briefly touch on the challenges which we do have with bowel cancer screening itself. So one of the main one is stigma. It might sound funny to people, but people are still quite uncomfortable to talk about their sort of habits of bowel habits and what needs to be done. And actually, even mentioning the testing kit, it can be quite sort of uncomfortable for people. And I completely understand this also falls within the sort of cultural and religious and language barriers, because sometimes culturally we do not talk about these things, depending, because of course we're all culturally different, not only from the cultural point of view, but religious point of view, language point of view. And of course, every country is different wherever we go, because we come from different parts of the world. We deal with sort of stuff in a different way. So this is one of the challenges which we always go with in the community. Speaking, whichever community we go and speak to, it's a different way of how we actually sort of phrase things, how we communicate. The message is always the same, it's just differently phrased. So it's sort of appropriate for the sort of community which we speak to. One of the main thing is also getting the message out, because I know as much as we're talking about the age of 50 to 74 and above, we also need to reach younger generations, because we're finding quite a lot of people under the ages of 50 to actually to have the bowel cancer itself. So it's even mentioning, if you have family members, regardless of the age, if they're experiencing the symptoms, just explain to them the symptoms, which are, I know, sometimes uncomfortable to say blood in the poo or anything like that, but please do tell them that literally the easiest thing to do is literally to go and speak to the GP, because the GP will be able to help. Participation, of course, it's one of the biggest sort of reasons why we're actually all doing it, because still within, and I can again talk about the two boroughs which I'm actually looking here within England, we have at least 50% of testing kits never being returned, and the reasons for that is literally overcome literally here and on this sort of slide of the challenges which we're coming for and talking about. And of course, as I mentioned already, multicultural and multi-religion society, and the area where I'm from, we're very multicultural, very multi-religious, very multi-ethnicity. So it's a very sort of a variety approach of the communities where we actually can help. And also we do have language barriers, because there are people who do not speak English, or they're not able to speak English. So we're literally trying to create leaflets, posters, and even communications in a variety of languages to try and help as much as we can. Because again, we're all in the same sort of I always say we're same at the community regardless where we're coming from and where we are from. So we're trying to help to sort of to minimize, to bridge the gap between all of the sort of communities. Um, One of the main one is of course the underserved populations, and that just means the populations which are not appropriately sort of helped within a healthcare, or they're not getting appropriate healthcare support. And that means anything like people in prison, people who are experiencing homelessness, people who are within drug and alcohol services, people which are in care homes, etc., etc. So these are the sort of the type of the communities which we're trying to reach as much as possible. And we have a variety of programs within sort of all of these populations when we're trying to help as much as we can. Because again, to be able to be part of the national screening program, people need to be registered with the GP and they need to have sort of an address where the testing kit needs to go. So that's why within our sort of area, we're also trying to help people who do not have that, with the help of course, the third sector services in general. And of course, as I sort of mentioned it also that one of the underserved populations is, of course, it's a Gypsy Roma and traveler community, which we're also trying to help because we do know that majority of the community now it's of course within the brick and mortar, if I'm correctly pronouncing that, brick and mortar sort of accommodation, but there's still members of the community which we would love to try and help in a way of actually changing the process because I always say not everything works for everybody within the community in general. Um, Now, resources, this is actually quite an interesting one because, guys, as you know, NHS is going through quite a variety of changes. Not only the NHS, but every organization needs. So we're literally trying to do things in a sort of different way to try and sort of find an innovative way of actually doing everything and trying to help the community. And I know I've said community millions of times, but this is literally community work, which we're trying to sort of to try and put forward to people to try and help as much as we can. So these are the sort of the main challenges which we always sort of are going to be. They're always going to be there, but we also have systematic challenges, which means all the policies and protocol which exist within the actual national program, and we're trying to, like I said, find a way to actually to do that in a sort of the easiest way with the community in general. Um, Key facts to remember. And I know this is sort of like summarize everything in sort of in a snapshot, but anybody ages 50 to 74, you will receive the screening by the FIT test. Anybody ages below 50 with symptoms will go to the GP. But again, also if you're 50 to 74 or in any age with the symptoms, please go to your GP itself. Um, Ages 75 or over, you can either go via the BCS program hub, which is the number which I'm going to leave at the end, but also if you're having symptoms, please go to your GP. And this is just literally again a snapshot that if you're part of the symptomatic program, you will go every 2 years, you will receive a testing kit. And again, the same for ages 75 and over. I think this slide does sound, now reading it, it does sound a little bit complex, but I will repeat again. So if you have symptoms, regardless of the age, please go to your GP. If you don't have symptoms and you're of the ages of 50 and over, you will receive a testing kit directly to your home address. But please do speak to your younger members of the family, which is really important. Just at least to share the simple information is, if anything is wrong, please go to your GP. Why do it? I think this is a perfect sort of example. It is very quick, it is free, and it can save definitely a life. And I do like this sort of quote, together we can save lives through early detection, which is true. As I always say, I might be speaking maybe to 4 people today, 5 people, 10 people, it doesn't really matter. By the studies, we all have at least 10 close friends, and we might be talking to our 10 close friends today about what we actually heard today. And there's those 10 close friends will be talking to their 10 close friends, and so on and so on. It's all word of mouth because sometimes even having a simple conversation about what you have heard on the day, it's more than enough to actually to share the information, which is really, really important. And the last bit is literally contact information. So this is for England, Scotland, Wales, and Northern Ireland. I always say that anyone can order the testing kit if you're over the age of 75 plus. Also, people who are within the extension age, which I said 50 to 74, you can literally call and ask for a replacement kit because sometimes I have heard from the members of the community that they have ordered a testing kit, the testing kit got lost in post, or I don't know, suddenly by mistake they have thrown away the testing kit or they cannot find a testing kit, you will be able to actually to reorder replacement kit itself. But these are the number for all of the regions within the UK. And like I said, the processes might be a little bit slightly different, but majority of the national screening program, it's exactly the same. It's a testing kit, return the testing kit, the results, and if anything is sort of to be followed up, it will be followed up by the members of the team. And that's it from me.
Brilliant. Thank you so much for that. Very, very informative. Um, I'm going to ask if anyone has any questions, put them in the chat or unmute yourself and feel free to ask a question. I know that Lauren got a couple of questions emailed over to herself,
Brilliant.
so we can start with those.
Well, actually, you answered a few of them. One being if it was lost or damaged, which you've just answered at the end. It's easy enough. It's nice to know to order a new one, but also around sort of the 2 year timeline of when you get a new one. If you were to experience symptoms even as soon as 3 months after completing the screening program, it's still important to visit your GP if you're experiencing any of those significant symptoms. No, just sort of to confirm no matter how soon to that sort of the screening program that's taken place.
Always the safest thing is to actually to do, like I said, please go to your GP, but please be also aware, like I said, constipation and diarrhea, when we talk about that, as we're talking about it, um, I would always say if, let's say we change something in our diet which we have not eaten before, of course, there is a chance for us developing either diarrhea or constipation because of the changes itself. So we know that that's the reason why the constipation is happening. But if something continues for over 3 weeks, then we definitely don't wait any longer, because majority of the time when I did speak to actually patients who have developed bowel cancer, majority of the time they will literally say to me they have had symptoms like diarrhea and constipation which lasted for months and they didn't do anything about that. That's problematic. And majority of the time when we do have constipation, and I know that sometimes people always say, oh, I drink water, I drink coffee and tea. Coffee and tea, yeah, they're made with water, but coffee and tea are still very much a diuretic, so they will make you go to the toilet also. Alcohol, it's also not water. Water is water when we're literally talking about bottle of water, no adverts for the actual for the but we're literally talking about water. It's very important because of course the when the food passes through the actual bowel system, the main place where the actual stool is getting the actual moisture or the water is from the bowel itself when we drink the actual water itself. So it's really, really important. And I think people sometimes do forget, because also sometimes when we have constipation, we can actually bleed because sometimes the sort of the lining of the bowel can be sort of because of the actual constipation can be torn or anything like that. So it's very important sort of to follow that up.
Another question that actually I had, because it's interesting to hear that the age brackets are different in different countries.
Mm.
And I think it can be quite difficult for people to stay up to date with different sort of criteria for different screenings for different health issues. Obviously, I know it's difficult for you to answer, but do you sort of
Sure.
anticipate any changes in the coming years to the age brackets? And sort of also, how would we hear of that? Would it be through your
Sure.
GP or through a letter in the post or that sort of thing?
Sure. So usually how it all works. So as you guys saw when I was actually showing how the age extensions actually work, age extension works on capacity. So that means every time when we lower the age for the actual bowel screening, that means that tens of thousands or more patients are literally within the actual region where we actually need to test them again. So it purely means doing more testing means we're doing checking more sort of tests to actually see if there is blood, but also means that whoever it's positive, which means that it has bloods, we will need to do colonoscopy. So that means not only the amount of people which are being tested, but also people who are coming to us being assessed by the nurses, etc. So it's all to do with capacity. Usually, how it works. The GPs are all informed via the national program when the actual age extension happens. But I remember when I joined the bowel cancer screening exactly 2 years ago on the dot, um, the GPs were still talking about patients about 60 to 74, which is quite confusing because the messaging has gone out. So my work was then literally to go to all of the GPs to meet everybody to literally to let them know. But of course, we do send newsletters and things like that to actually to inform people. Now, to us as a bowel cancer screening center, we actually informed all of the sort of primary, secondary, tertiary care sort of services what the age extension is. And like I said, recently, very recently, like I said, October 2024, that's when we lowered 50 and above. But like I said, there was gradual bit by bit as we go down. From that perspective, everything is different across the world. That doesn't mean that it does not exist. Some countries don't have it, as I sort of explained. But for us in Britain, because like I said, we're getting even people younger than sort of 50 to have bowel cancer. There is no immediate plan of expanding the age, but we do hear when when I say rumors, I mean plans to eventually to start lowering the actual age to 40. I can't give you the timeline. It can be 5 years, it can be 10 years, but it's all to do again with capacity and how many of us are available and how many people are actually going to be within the age extension again. But also to mention something, because I think people also need to understand that the age extension starts at 50. So if it starts at 50, it's always going to be on a even number of years when you're going to receive the testing kit. So let's say if I was 51 when the age extension started at 50, that means that I would not be actually getting the testing kit at 51. That would mean I will get the testing kit when I was 52. Regardless, I'm within the age extension. I hope that makes sense. But it's usually, so it's going to be 50, 52, 54, 56, and onwards to the end until we actually want to stop with the actual screening center itself. But like I said, if any changes are happening, we would definitely inform all of our sort of stakeholders what is actually happening. But I don't think it's going to happen anytime soon to be lowered again. It's all to do with capacity. Sorry, that was a long-winded answer, but I just
No,
wanted
no, it's
to,
perfect.
yeah,
Thank you.
Time for one more question, if there is one, because I'm very conscious of the time.
sure.
Anyone got any questions? Lauren, that was all your questions, was it? Okay, brilliant. Well, if we don't have any more questions, and if there are any questions afterwards, I'm sure you can let me know and then we can discuss them after Dusan. But thank you so much for that. That was really, really informative. And I hope that everybody today took something away from it. As I said, this has been recorded, so we can send it out. And it can be shared and it can be replayed. And as Dusan said, that's what we want from it. We want the information to be spread out to everybody. It's very, very important. But yeah, okay, thank you everybody, and have a good rest of your day.
Thank you very much, guys. Thank you for inviting me.
Thank you.